Welcome back. You're watching Sky News Tonight. The top stories this evening in COVID laws, including the requirement to self-isolate after a positive test, are set to end a month early in England. Sky News has spoken to people on the front line in eastern Ukraine about living with the daily threat of invasion. And Ian Stewart, who was convicted of killing the children's author Helen Bailey, has now been found guilty of murdering his wife 6 years earlier. Well, now, you are watching a COVID questions and answers special here on Sky News after the announcement by the Prime Minister about an early end to all legal COVID measures, chief among them an end to the need to self-isolate even after a positive test. The announcement comes, of course, at a difficult time for the Prime Minister politically, leading many to suspect a political motivation behind the move. But whether you believe that or not, England will be one of the first Western countries to leave restrictions behind. Here's the Prime Minister making that announcement.
Provided the current encouraging trends in the data continue, it is my expectation that we will be able to end the last domestic restrictions, including the legal requirement to self-isolate if you test positive, a full month early, Mr. Speaker.
And just to remind you how things stand under the current rules, if you test positive for COVID, you must self-isolate for 10 days. You can leave self-isolation early if you take a lateral flow test on day 5 and 6, as long as both tests are clear. The Prime Minister will outline his plan for living with COVID when Parliament returns from its recess on the 21st of February. The legal duty to self-isolate is expected to be lifted, therefore, a month earlier than planned, and as long as the data remains positive, the Prime Minister said. Well, let's discuss all that, putting your questions to my expert panel. I'm joined now by Mark Woolhouse, Professor of Infectious Disease Epidemiology at the University of Edinburgh, Chief Executive of the NHS Confederation, Matthew Taylor, and Clinical Nurse Specialist at the Eve Appeal charity, Hilary Maxwell. Very good to have you all here. And as I say, we've been getting a lot of questions sent in to us here at Sky News. And we've rolled together, one of the main questions been asked by nearly everyone that's contacted us. And they're asking, what are the signals here? Is this the end of the pandemic? Professor Woolhouse, give us your view.
Well, we've got to leave restrictions behind us at some stage. So the question is, what are the right trigger points? I'm very much in favour of following data, not dates. You'll remember from the lockdown we had early part of last year, 2021, it took an enormous amount of time for us to start to lift restrictions because people were being very, very cautious about this. And as a result, for example, on that occasion, schools stayed closed for months, even though levels of infections were low. And there were then fears that when we relaxed a lot of the restrictions that we did in July in the summer, that there would be a big wave of infections. And that really didn't materialize, certainly not on the scale that many people were concerned about. And the public health burden of COVID remained manageable. So I'm optimistic that that is what will happen on this occasion too.
OK, Matthew Taylor, from the NHS perspective, the end of the pandemic. Well, we've seen cases drop dramatically back in 2020, again in 2021, and then they've gone back up again. Could it be different this time?
Well, nobody wants another fall storm, do they? And yet we would all like to see life return to normal. So I think we need to hold the Prime Minister to his word, which is that we have to wait and see what happens over the next few weeks. I think ONS data just today suggests that the infection rate is going up. But nevertheless, the number of people in hospital, which is really the critical issue for the NHS, is falling. The number of people in intensive care is falling. But we've got a relatively high infection rate. We still have people dying from this condition. And there is, of course, still the danger of another variant. So I think we need to continue to observe the situation. I don't think we should make this question a kind of political virility test. I think we should be guided by the public interest. And the other thing is, I think we need to be really clear what we're saying to the public. So even today, the government's had to clarify that whilst the Prime Minister is hoping to remove all legal restrictions, it will not be the advice that you should go to work if you've got the virus. Now, we need to be clear about these things, because the one thing we've learned over the last 2 years is that if you have muddled and confusing messages for the public, it doesn't help anyone.
OK, we're going to get into more of those specifics as we continue through these questions. But Hilary Maxwell, just that broad overview from the front line, the end of the pandemic.
Well, obviously, it's always heartening to see things improving, of course. But I think we must remember that, for over 2 years now, people who are vulnerable have been asked to shield and self-isolate. And this has caused huge anxiety and concern for many, many people. And for me, who works in cancer care, that's been of considerable concern to those particular patients and their families. I think what is important is about that surety that we're going to give to those vulnerable people in terms of no need to now self-isolate. But for many people, COVID has symptoms similar to a cold. And I don't know many of my colleagues that don't come to work with a cold, but how are they now going to necessarily know the difference? And that may be of a huge concern to those people who are coming to chemotherapy appointments, radiotherapy appointments, immunotherapy appointments. So I think it is an obligation that we must try and provide some reassurance to those people who are vulnerable.
And then this question, thank you all for those opening comments. Now the specific questions, and this from Tracy, and I'm going to add into it a question that you've all touched on as well. Tracy wants to know what the scientific evidence is for relaxing restrictions. And Matthew Taylor, can I go with you first of all, because there are concerns that this may be a large dollop of politics in this decision by the Prime Minister as well. I mean, it's an open secret, isn't it? It's not even a secret that there are many on his back benches that wanted to see restrictions relaxed quite a long time ago.
Yeah, so look, I think it's incredibly important for policy and for public trust that these decisions are seen to be driven by the science. And I would actually encourage the government, when it makes these announcements, to be honest. If there is a serious group of people in the scientific community who don't agree. And now, in the end, yes, it is about science, but you have to make a judgment. And we have, as we have had throughout this crisis, on the one hand, the need to protect the NHS and public health. On the other hand, people's desire to be free and the desire of business, for example, the hospitality industry, to thrive. So that is a political judgment in the end. But we need to be honest with people about the science. And if the scientists don't agree, well, we should be honest about that too. The important things we see at the moment is this continued decline in the number of people in hospital and getting and very sick. And as long as that continues, then I think the Prime Minister's plan is one which people will broadly support. But we do need to keep an eye on this. As I said before, new variants, not just new variants, it's the decline in immunity. Will we get to the situation where we start to be vulnerable again? We need to watch that as well. And difficult challenges in the health service, because on the one hand, we are still suffering from high absence rates because people are off with COVID. So it'd be great to get those people back to work even earlier. But then the last thing you want to do is to bring people into hospital who've got a virus, passing it on to people who are vulnerable. So that's a tricky dilemma for health service leaders.
Professor Woolhouse, pick up on that about a new variant. So many people asking about that. I mean, there are going to be new variants. We more or less know that for certain. The question is, how dangerous will they be? And added to that, so will it affect our ability to detect emerging threats from COVID if we end up testing less?
Well, first, let's put that in context. There are 3 drivers of the level of infection over the next 12 months or so, at least. One of them is new variants, which I'll come to, but the other is waning immunity, both natural immunity and the protection the vaccines afford us. So we have to think about that, and scientists are monitoring that very closely, as you would expect. And the other is people's behavior. So we were talking earlier about the possibility of a resurgence when these legal restrictions are removed. That's not automatic. That depends very much on what people actually do. And my sense of this over the course of the pandemic is people have actually been far more cautious, and responsible and careful than scientists were giving them credit for. And that's one of the reasons why we haven't seen major resurgences so far as restrictions have been lifted. The new variants is the big unknown. We can't know when the next variant will come. I'm pretty sure it will come sometime, but I can't tell you when. And nor can we know the properties that it will have, whether it be more pathogenic, as the Delta was compared with previous variants, or more transmissible, as Omicron was, but perhaps more mild as well. We simply can't tell that. So one of the things that has to be built into the public health planning going forward for the whole of the UK is flexibility. We must have systems in place where we can respond rapidly if a potentially threatening new variant does arrive. The way that we actually did respond quite rapidly when Omicron arrived, and that was vital for controlling this latest wave. And we may well have to do that again. So we mustn't assume that everything we do is irreversible indefinitely.
Okay,
we'll be flexible.
That's interesting to hear, not irreversible, and the ability then to bring in restrictions as quickly as possible.
Well, the ability to change people's behaviour as quickly as possible, which doesn't necessarily rely on legal requirements. We can do that very effectively with strong public health advice, particularly if people recognise the need for it.
OK, got a direct question for you, Hilary Maxwell, from Lorraine. Lorraine asks, and you did touch upon this, but please expand. What about those who are clinically vulnerable? How living with COVID, how do they do that?
I think it is difficult. It is a balance of risk. Certainly, in my cancer care practice, I certainly wouldn't want my patients who time and life is very valuable to be living as hermits. But I think it is about balancing that risk and often being cautious, but without stopping living as well. I think, without a doubt, case numbers are still quite high. We can't deny that. And hospital numbers are still quite high. And sadly, people are still dying from this disease. So for those people who are clinically vulnerable, this is still a huge worry. We know that chemotherapies and immunotherapies affect the immune system. And despite, the great strides we've made in vaccines, which is absolutely phenomenal, those people will still be anxious and cautious because they've spent so long now shielding from a very difficult and dangerous virus. And I think has been clearly stated, we are going to get more variants, and we don't know what that's going to look like on the ground. And so people will inevitably feel nervous. But I suppose what I would say is the same that I would say to my patients, is to be cautious, but to ensure that you still go out and live your life.
And what about the family and friends of those clinically vulnerable who want to visit them? Matthew Taylor, we've got this question from Katie, who says, when will the NHS be able to lift the rules around patient visits? I know you don't run an individual hospital or trust, but Katie has a child, and so many people in this situation. Katie has a child who's been going through cancer treatment since 2020, but only one parent is allowed to attend treatment, and it's of course been very distressing for them all, for Katie and of course her child and all the relatives around them. We're not at that point yet, but do you think we're going to get there fairly soon?
Well, I think this is the point I was making earlier, which is that in many ways, the health service welcomes the removal of restrictions more than anybody, in the sense that we are suffering from high absence rates of staff. It's more hot dip. We heard just yesterday about the plan for elective recovery, which is a very demanding plan. That's more difficult when you've got infection control measures in hospitals, which means that you can't use the space as flexibly as you might want. And of course, hospital leaders want patients to be able to be visited by relatives. They want the patient experience to be as good as possible. And I think that one of the things that was hardest for health staff throughout the last 2 years has been applying those restrictions, which mean that patients have not been able to be with their loved ones. So, we want to be able to move back to normal as soon as possible. But on the other hand, we don't want a situation in which infection rates rise and more people are sick, because that's going to be even more disruptive. So this is why this is a difficult balancing act. And the other thing I want to say is it's not just about hospitals. We have much higher rates of infection in the community. We've got very high rates of long COVID as well. So the COVID phenomenon is still out there and is still having an impact on all parts of the health service.
And I suppose that goes for social care as well, in terms of people wanting to be able to go in to visit, but of course so wanting to be careful about their friends and relatives who are in there. We've touched on this issue, but let's concentrate on it now, about some people who do test positive but no longer have to self-isolate by law. The Prime Minister's spokesperson clarified that the government will not, of course, be recommending those who test positive for COVID go into work. But where does that leave employers and employees? Do you think we'll have a spike in cases because people with COVID will go into work? And Professor Woolhouse, particularly if they don't know they have COVID because they begin to stop testing.
Well, this is something that's not clear right now, is it? The introduction of self-testing seems to have been very effective indeed in helping us, not the sole factor, but helping us control the Omicron wave. And it's been very important for the aspects that my two fellow panelists have nicely emphasized in the last few minutes. One is protecting people who are clinically vulnerable, and also by protecting the healthcare system. I would add to that the social care system and care homes as well. So I very much hope that the end of legal restrictions to self-isolate does not mean an end to people testing themselves, whether it's for those reasons or for just going to work. And the uptake of the testing has been quite phenomenal over the last few weeks. 85% of the population say they've tested once, at least in the last week. More than half have tested 3 times. And I would strongly suspect that people who are prepared to test themselves are also prepared to modify their behavior should they test positive. So I very much hope that again, the change in the legal requirements here, and there's never been a legal requirement to self-test, and people are doing it anyway. So this will not lead to a drastic change in behavior across all of society, protecting the vulnerable and reducing community transmission. And I'm optimistic about that.
And Hilary Maxwell, I guess in your area, the last thing you want is people coming into work who've tested positive or haven't tested, but have the disease.
And I think this is of concern because of the symptomatology of COVID. That's, some people have likened it to a cold, and particularly as the variants have become perhaps less intense, there is a risk that, as healthcare professionals, we may well go into a hospital setting with what we think is a cold, but is actually COVID. On the plus side, what I would say is I think healthcare professionals are extremely responsible. And I think, we've tested routinely. And I think most people are perhaps now just a little bit more aware that if they have cold-like symptoms, that they will have on their radar that this could well be COVID and will do a self-test. So despite the fact that, as my colleague said, there hasn't been a legal requirement, people are much more in tune and perhaps a little bit more heightened in their awareness that this is a sensible step to take, because the last thing, as you say, you want to do is to infect vulnerable people. Not least, obviously, we still have high sickness numbers, as been stated in the health service. And of course, usually if a clinician gets it, they've probably got it from their family. And so on it goes round the family. You get a long stay absence from that clinician. And that's no good to anybody whatsoever at all, and certainly not the patient. So I really hope that people will have that heightened awareness. But I think it's very difficult to know how people will keep that heightened awareness up for.
And Professor Woolhouse, do you think we're going to see an increase in cases in the wider community, in schools, in those hospitality areas?
Well, for the reasons we've been discussing, particularly the willingness of people to self-test and change their behaviour, I don't think that's a given. It's a clear risk. And we've already discussed the trends in cases, and I think you mentioned at the beginning of the piece that the numbers of infections have increased ever so slightly this week. That's actually mostly in school children and has been for some time. The main wave in the adult population seemed to have passed over the Christmas period. So I'm not at this stage expecting a major rebound, but there might be some adjustment. The key, and we've already highlighted this point, is that those cases don't translate into hospitalizations. And that does mean taking precautions to prevent transmission in environments where there are vulnerable people.
And Matthew Taylor, got a lot to address then with you. You've got this issue of staff testing positive, no longer needing to self-isolate, but we don't want them going into work, certainly not in healthcare settings. And this issue of wider community transition. Let's put that together with what was announced by the government yesterday, the attempt to deal with the huge backlogs that have built up, that are building up in people who need care for things other than COVID. I mean, it goes without saying that if community transition goes up, there will be more COVID cases coming into hospitals, and that'll derail the backlog plan.
Yeah, there's no question the elective recovery plan yesterday was a best case scenario. We really hope that we can deliver on that plan, but it does require things to go our way. And one of the things it requires to go our way is that we don't see a big increase in the infection rate or a variant, or, as Professor Woolhouse said, a decline in immunity leading to cases becoming more severe. So there are lots of ways in which COVID can interfere with the plan, which relies on things going the right way. And even then, we're going to see waiting lists go up for the next couple of years. You know, I think an important part of this conversation is that the Prime Minister has promised not just an announcement about removing legal restrictions, but a plan on how we live with COVID. And I think, you know, this is the point we're all emphasising, that we do need to think this through. You know, in other cultures, countries who have, for example, experienced pandemics before in the past, and it is considered inappropriate to go into work even with a cold. There is a sensitivity to the idea that actually it's not a good idea if you've got anything that's infectious to be around other people. There are other countries where wearing masks is not just something that you do in a global pandemic, but actually it's something that you might do more conventionally because maybe you are concerned that you've got a cold or you don't want to catch a cold. So I also think that we've got to ensure that we remain prepared in case things do go wrong. We mustn't just breathe a sigh of relief. We are still in a position where another round of this pandemic is more likely than having a pandemic was 3 or 4 years ago. We mustn't behave as if somehow this is past and we can wait decades before it rises up again. So I also think this point about testing is really important. It is absolutely right that people have tested, they wanted to test. I think that for a long time into the future, if you are having someone in your house who had a vulnerability, you would want to test yourself. If you worked with someone like that, you'd want to test yourself. And indeed, one of the other things we heard yesterday from the government was the next steps in a kind of diagnostic revolution. The idea that we test ourselves about our health is going to become more part of our lives anyway. So one of the questions about COVID is the habits that will last even beyond COVID. And I think testing yourself and I think thinking about how you protect other people from any illness you might have, these are good habits that should last.
That's a very, very interesting point you make. And Professor Woolhouse, you're nodding along there. So do you think that these habits have now become ingrained, that the psyche has changed, the government doesn't need to get involved, that peer pressure, your own internal pressure will mean that you wear a mask if you've got symptoms of a cold, you won't go into work and you'll test yourself?
I think that's a real possibility. I mean, this has been an event the last 2 years on a truly historical scale, and it's going to leave long-term effects behind of all kinds. But I think this behavioural change we've been talking about is likely to be one of them. The only note of caution I'd add is throughout this pandemic, actually predicting what people will do has turned out to be rather difficult. But as I said earlier, in general, they've actually been more cautious, more responsible, more careful than many people have expected. So if that continues, then I think, yes, indeed, these behavioural changes could be long-term. And incidentally, that will have some interesting impacts because if you recall, we haven't actually had a major influenza outbreak for the last 2 years. And there's very clear and obvious reasons for that. If our behaviour is sufficient to suppress COVID, it is easily sufficient to suppress influenza. So there may be quite a difference to the epidemiology of respiratory infections generally in the UK, and that will have big implications, of course, on...
We're just nearly out of time. I'm sorry to jump in. We're nearly out of time. I really want to... I'm seeing you nodding along there, Hilary. Just give us your thoughts on that, on the change in people's personal behaviour.
I think we have seen considerable change, and I do hope that's one that will be sustainable. I think we just have to be respectful of each other in society and recognise that we don't know who we're walking by or encountering who may be vulnerable. And we have to think about, would we want that for our own families or relatives? And I don't think we would. So I think, and I very much hope that those behavioural changes will last. However, I know that we're not very good at keeping New Year's resolutions, but I hope that the last 2 years probably have been a bit of a shock.
Well, that's a resolution we all keep. It's been great talking to you all. Thank you so much indeed for sharing your experience and your expertise with us. Hilary Maxwell, Matthew Taylor and Professor Mark Woolhouse. And you're watching Sky News Tonight. Coming up at 8 o'clock, we'll have the latest on that news from the Prime Minister that all COVID restrictions may be gone in England within a fortnight. It's 8 o'clock. This is